Your number one concern that brought you in to see Dr. Kaiser, your lower back pain. Can you tell us kind of how long it had going on? And
I was actually in bed for 2 months where I couldn't do anything. It was just so horrible. I couldn't turn, I couldn't sleep, I couldn't walk. It was just, and I had exhausted all my normal medical things, and it just wasn't happening. Neither was therapy or anything.
what were you trying to relieve all the back pain?
The pain, just so I could want to move.
Mm-hmm.
I couldn't walk, I couldn't do anything. I was walking sideways. It was just really awful. I'd never experienced anything like that in my life. So
What brought that about?
I have no idea. I just woke up and there it was. And it's probably just from moving boxes, or, I play a lot of tennis and things like that. It just probably wear and tear or something. But it's never happened, ever. So it was like a new pain.
Mm-hmm.
And I just couldn't deal with it.
And you weren't finding relief from
no
medications
relief,
or the bed rest?
Nothing. There was no relief.
Okay.
So,
So what I'm going to ask you is, on a scale of 1 to 10, 1 being 10% improvement, 10 being 100% improvement, where would you think you are right now from when you first came in with that back pain?
right now, today, it feels more like 90%
Mm-hmm.
because I was so taken out completely and in so much pain.
So to come back occasionally, but overall you feel like you're just a completely new person.
Yes. My husband we just totally notice it almost feels like maybe I should be out there playing or something, but I'm just going to go slow.
Maintain it.
See, yeah.
Great.
But I get to do stuff now. I'm walking around, I get to do stuff. I don't have to lay there or sit in a chair and,
Mm-hmm.
just be a vegetable sitting there in so much pain.
So for them, maybe a little bit of improvement, mild improvement on the fatigue?
Yeah, I would say.
20% maybe?
Yeah, because I can get to walk around at least.
Yeah.
And do stuff. And I'm starting
It's a
to do
stepping
housework.
stone.
Yeah.
It's a stepping stone. You just gradually have to get there, and as long as you're seeing some improvement, it's just hopefully going to keep on going for it. You look great every time you come in. You seem like you have tons of energy.
I always get excited to come in because we have just a silly name because I'm gonna go in to get I'm gonna go in for my magic. Because that's what we just said. He just works his magic. He knows exactly what's not in alignment. Where I came in with a lot of fear, so because I had tried a chiropractor once before, several years ago, maybe about 15 to 20 years ago or something. So I was really hesitant, but I was ready to try anything, for my back pain, because that's how much I was hurting. I was just ready to just try anything.
Good, we're glad. Now the last thing is some digestion problems.
Yeah.
What kind of problems were you having, and did you think that coming and seeing a chiropractor was going to help with that?
I kind of didn't even, I just kind of mentioned it because I've always had stomach problems, and about, I guess maybe 7 or 8 years ago, I was in the hospital. I got some kind of a weird bacteria in my system, so it took me out for about a year, and with, internal bleeding and the whole thing, and I had pancreatitis, the whole thing. It just ruined my whole digestive system. And so it's kind of worked itself back. So I'm pretty careful about what I eat.
Okay, so you're maintaining a healthy diet as well. Good. Staying well-rounded. Have you noticed any improvement in that area?
Yeah, I did. I did. It's just like I said, I haven't thought about it because I've been zeroing on my lower back, and it's just noticing that the pain is going away, and with my activity coming back, I haven't thought about anything else. I've just been so happy that my back is getting well.
Okay, so improvement-wise, like 10 to 100%. Since you came in for the, digestive problems, you weren't even coming in for that. But where do you think the improvement on that has been?
Oh, I don't know. I haven't thought about it. I'm really eating well, so which is, I guess it is kind of unusual because I'm eating well. I guess it's because I'm happy that I'm not in pain.
Right.
So,
Good.
yeah.
Good. So now I just want to ask you about your first NUCA treatment. Can you kind of just describe it for me? Was it what you thought it was going to be? Did you think it was going to be more traditional, or was it painful?
Was definitely, it wasn't painful, and of course it was really not painful because I was expecting, something traumatic to happen. I was very, very, very skeptical when I first came in, really, really skeptical. And then when it started being so calm from the very beginning and the gentleness of it all, I thought, this is crazy. This is not, how could it be gentle and then help? You know what I mean? Because his way of doing things is gentle. But what he was doing was not invasive, or it was too gentle to make a difference. So I stayed skeptical for a while. And then as he started to do different things to me, I thought, how could this work? How could, this gentle stuff do anything? But then, like I said, that's why we call it magic. I mean, quote unquote, we've kind of given a name, the magic, because he's not doing anything to hurt me. And I have so many health issues, and I'm in the hospital all the time and stuff like that. So it's like, this is strange because he's not hurting me, and I don't have to ingest anything to upset my stomach, and so he's not recommending, anything like that. So it was like kind of, we just call it magic because I don't understand it. I've looked it up online and stuff and researched it, but it's totally not what I expected. So
now we're seeing all these great improvements. I mean, pretty much 100% in the areas that you're not thinking about anymore. About 90% in the back, your number one concern. Did you see it right away, or do you think it kind of happened gradually over time with you? Is it something you kind of had to have patience with?
You mean since I've been here?
Yeah, since your first adjustment. When did you start seeing the improvement to the point where we've gotten to now, at 90 to 100%?
Probably around the third time is when my skepticism started to leave, so I could stop and notice, and try to believe in what's happening. Think about it, if it's, what he says educates me. So even though he doesn't say eat this, it makes you think about what you're doing. About like the past couple days with the questions, and to think about, what's making my body work and stuff.
Getting your whole life kind of in balance.
Yeah,
not just your body.
So when you try to go do something stupid or eat something, it's kind of like, is this going to help? What's it going to tell my body? When you're not saying it, but you're kind of like, you're thinking about it for some reason. It's just kind of like a subconscious thing going on. It's kind of weird, but that's what I tell my husband.
Okay.
So all I know is that it just is helping my body to heal itself, and without added pain, pain and suffering. Or I like the fact that I'm not who I am, and my body is not being invaded, not mentally or physically not being, there's nothing invasive I feel that he's doing to make me have to get healed. So that's what I like about it. So.
Great.